Hello, welcome to Chala University Hospital Intensive Care Unit. My name is Emma.
And my name is Mark, and we are both nurses in the ICU.
We know that patients who have spent some time in the ICU have mixed feelings and emotions about their time with us.
And so we have made this video to help you see where you were cared for and to help you understand some of the experiences you may have had.
Before we start, you'll notice we're in different coloured uniforms. You may have seen different shades of blue, as well as green, white, purple and red, and other people in regular professional clothing.
We know it can be hard to keep track of who's who, so nurses and ICU doctors typically wear blue, with physios and surgeons in green.
You may have met speech therapists, dietitians, porters, care assistants, catering staff, psychologists, occupational therapists and cleaning staff, who are generally also recognisable by the colour that they wear.
So come on in and we'll show you around.
All of the beds on this side of the unit are in single rooms. We do have a 9-bedded space also, which has 6 beds on an open floor and 3 single rooms. If you were a patient in this unit, you may have experienced a busier environment with more noise and an increased sense of other patients and their family members nearby. Although all of the bed spaces in ICU are slightly different, this will give you a sense of what they are like. These doors may have been open or closed depending on your needs and condition. Either way, you will have had a nurse with you at all times, looking after you 24/7. You may remember being in bed or sitting out in a chair. We do our best to get our patients moving as soon as they are ready. A small door in your room allowed staff to take out bed sheets and other items that needed cleaning. Having the separate space is an important part of reducing infections in hospital. There's lots of equipment in an ICU room. They all serve a purpose, and it might help you to know what some of them are. The mattresses in ICU are filled with air to help protect the skin. Many people tell us they can feel the air moving inside the mattress. This is the ventilator that supports breathing. Many patients will require help with breathing and may have to wear a mask to deliver oxygen, or may have a tube placed in their throat, through their mouth or through their neck, to deliver oxygen that they need.
This is the suction machine. This clears secretions from the airway when patients is unable to cough. So you may have experienced suctioning through your mouth, through your endotracheal tube, or through the tracheostomy if you had one. There are many reasons why patients cannot take food and drink as they normally do when they are in ICU. Many patients use a thin tube that goes into their nose, down into their stomach to deliver nutrition and medicine in liquid form. This is known as the nasogastric tube or an NG tube.
These are our infusion pumps. These machines will have delivered fluids and medicines into your veins, such as sedation, pain relief and antibiotics during your stay in ICU. This is called a hemofiltration machine. This is a form of kidney dialysis that clears the blood of toxins when the kidneys are not working properly. This is our thermometer. We use this to check your temperature multiple times a day. We do this by rolling it across your forehead and behind your ear.
You may have needed a central line or a vascath placed at the side of your neck to allow medicines to be given to run the dialysis and for more advanced monitoring while you were ill. You may also have needed an arterial line placed in your arm, which monitored your blood pressure and allowed us to take blood samples.
When in ICU, you are likely to have had a catheter inserted into your bladder. This was used to collect and measure the volume of urine, an important part of monitoring how your body is coping with your condition. This is a device with a sling attached that helps patients who are not strong enough to move themselves independently to move from the bed to the chair and back again. Sitting out is an important part of recovery from critical illness. It helps to build strength and makes it easier to interact with those around you. You may have been aware of a number of monitors behind you. They displayed vital information about your heart, breathing and blood pressure. You are likely to have needed an X-ray and other scans during your admission. X-rays are typically done in the bed by a portable X-ray machine that is brought to you. You may remember having a hard board put behind your back while our radiographers took X-rays of your chest. At other times, you may have been brought out of the unit for a CT or MRI scan. An ICU nurse and doctor would have been with you at all times. You might have worn these mittens during your stay in ICU. These can be difficult to tolerate, but are used only when needed to stop you accidentally pulling out your lines.
This is a specialized stocking that we use in ICU. You may have felt it squeezing on and off, and this device will prevent blood clots in your leg.
You may also have been aware of a range of sounds, such as alarms and beeps from the various pieces of equipment around you. Although these can be stressful, their purpose is to help staff monitor their patients.
Hello, my name is Melanie Ryberg and I am the clinical psychologist here in the ICU at TUH. Now that you've seen the unit, I'd like to tell you a little bit more that might help you to understand your experience. When you've been critically ill, you may have been asleep for long periods because you were unconscious or sedated. Because of this, patients often have difficulty remembering what happened to them. As the brain can still be busy during this time, but is very clouded because of the illness, the medication and other factors, many patients report experiencing vivid dreams, nightmares or hallucinations, which can be very upsetting. It is also not uncommon for patients to believe that staff are trying to harm them when they're delivering the care patients need to help them recover. This is part of delirium, which many of our patients experience while in our care. We know that being in ICU can be a very stressful and frightening experience, and the recovery process can be longer and more complicated than people think. If you are struggling to come to terms with what happened to you, speak to your GP about it. ICU Steps is also a very valuable resource, providing support and guidance to people after critical illness, and you'll find their details online at icusteps.ie. Where available, post-ICU clinics, such as the one we have here at TUH, can also be an important support to you in your recovery journey. The experience of being in ICU can be very confusing and scary, but we hope that this video will help you to better understand your ICU experience, and we wish you well with your continued recovery.